So I was on vacation in Jamaica.
Okay.
And actually went horseback riding under the moonlight, which
Wow.
was really nice.
Good for you.
However, I ended up falling.
Okay.
And I fell on my back. And ever since then, there's just been this
On your back.
feeling, yes. And it's been quite difficult to sleep.
And when did this happen?
2 weeks ago.
2 weeks ago. Okay. And you mentioned that you fell off the horse.
Yes. Right.
And I assume you weren't wearing any protection.
Just a helmet.
Okay. So did you hit your head?
No, just my back.
Okay. All right. And were you in a lot of pain after that happened?
A little bit, but I mostly felt it, I guess, the next day.
All right. Did you take any medication for the fall?
No.
No medication. Okay. And I see that I have your chart here from the last time that we did a head-to-toe assessment. Are you on any new medication since I last saw you, Emma?
No.
No new medication, okay. Any tingling sensations in your body, in your back, your face?
Back.
Tingling sensations in your back. And would you describe them as being pleasant, or are they quite, unpleasant?
Kind of uncomfortable. It's making it difficult to sleep.
Okay. Do they wake you up at night?
Yes.
They wake you up at night? All right, sounds good. So your medical chart is up to date. And I'm going to go ahead and perform a cranial nerve exam, and then I'm going to take a look at your back. And I'll do a neurological assessment to see if any, nerves were damaged, if anything in your spine was damaged as a result of the fall. And we'll take it from there. We may have you take a couple more tests if necessary. And if not, I'll do some treatment as well, and we'll get to the bottom of it.
Okay, thank you.
Sounds good. Okay. So I'm going to begin by just taking your temperature. Any flu-like symptoms in the last 2 weeks?
No.
Okay. 98.7, so you don't have a fever. That's good. All right, let's check your levels of oxygenation. Index finger, please. And just relax. 6, 5, 4, 3, 2, 1. All right, so 99% oxygenation and 84 beats per minute. So very good.
That's good, thank you.
Yes. All right, let's go ahead and do a quick eye exam. I want you to just stare into the distance. Just going to take a look at your eyes. All right. Okay. Pupils are round and reactive to light. Can you look at my nose? I'm going to check the consensual response. Right, okay. Left, very good. All right. Now can you please look here? Try to keep your head steady and just follow the light. And I'm going to bring it closer to your nose and farther away. Good. So eyes are accommodating. I'm not seeing any neurological red flags as of right now. Let's go ahead and continue with the exam. Can you please close your eyes for me? And I'm going to make a sound, and I want you to point towards the sound with your hands, either one of them, okay? Good. 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 Okay. All right, I'm going to go ahead and look inside your ears and see if there's any sign of any cerebral fluid buildup, anything that may indicate anything wrong with your ears. Is that okay?
Yes.
All right. So I'm going to start with this right here. Okay. Just make sure that this is on. Okay. So the ear auricle looks normal. No external discharge, no inflammation, no redness. Does this hurt pinching up?
No.
Pinching down?
No.
Lateral?
No.
Right, I'm going to go ahead and look at your tympanic membrane. Okay. Need a slightly better position. Okay. Able to visualize your tympanic membrane. Well-defined margins, pearly gray color. No sign of any cerebral fluid buildup, so that looks normal.
Yes.
Gonna go ahead and do the same over on the other ear. Okay. Looks normal on the exterior. Okay. I'm able to visualize the tympanic membrane. Inner ear looks healthy. A little bit of a redness on the canal of the ear. But everything looks okay, so I'm not too concerned. So next up, I'm going to assess the dermatomes, and I'm going to do a neurological assessment of your whole body. And that involves me touching you with a couple of different objects while your eyes are closed and asking you some questions.
Okay.
Is that okay?
Yes.
Good. All right, so go ahead and keep your eyes closed. And we're going to start off by doing a test that's called sharp or dull. Can you feel this?
Yeah.
Okay, so that's dull. Can you feel this?
Yeah.
That's sharp. All right, so tell me if I'm touching you with sharp or dull.
Dull.
Good.
Sharp.
Good.
Sharp.
Good.
Dull. Sharp.
Good.
Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull.
Okay, now I'm going to touch with the dull object. I want you to keep your eyes closed and tell me when it stops. So just say yes.
Yes. Yes. Yes. Yes.
Okay.
Yes. 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 Yes.
All right, very good. All right, continue keeping your eyes closed. I'm going to spray with some water, and I want you to tell me where I'm spraying it. So try to localize it to the best of your ability.
Arm.
Okay,
Shoulder.
good.
Knee.
Left or right?
Left.
Good.
Right hand.
Good.
Chest. Right hand. Head. Neck.
Good.
Right shoulder. Left shoulder. Right arm. Left wrist. Back. And left calf.
Good.
Actually, not a calf.
I ran out of water. All right. Next up, we're going to do a test that is called cold or sharp. And I have here a sharp object and a cold one. So keep your eyes closed and just say sharp or cold.
Cold. Sharp. Cold. Sharp. Cold. Sharp. Cold. 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 Sharp.
Okay. All right, next up, I'm going to do some tapping on the bony prominences of your body and try to trigger any neurological responses that may provoke pain, zapping, any sensations that may be out of the norm that I should observe to diagnose you. So keep your eyes closed and let me know if you feel anything unpleasant. I'm going to start at your head and move my way down. Okay. Right. Any pain there?
Like
A little bit. Not seeing any reaction on your skin, so that's good. Alright, that's a good resonant sound. Alright, next up, I'm going to just feel your lymph nodes. Sometimes when we have a trauma to the body, the lymph nodes can be the first ones to kind of swell up and react. So I'm going to go ahead and feel your neck lymph nodes under the jawline here, and just going down your neck and see if anything is inflamed.
Okay.
Alright. And just going to look first to my light and see if I observe any swelling, anything that may be visually indicative of any enlargement of the lymph nodes. Okay. Not seeing anything. Move your head a little bit more towards the left side. There you go. Alright. So I can take a look at the back of your head as well. That's looking good. Not seeing anything concerning. And alright, very good. So nothing visually indicative of any lymph node enlargement.
That's good.
I'm just going to use my hands now and palpate the lymph nodes. Alright, so I'm going to start off with the preauricular lymph nodes in the front. The parotid lymph node right next to it. Dermal bone not enlarged. Not tender. The postauricular lymph nodes in the back. And the occipital ones, all the way in the back of the head. Okay. Superficial cervical going down towards the lymph nodes of the neck. Deep cervical. muscular. Mobile again, not enlarged, not swollen. Submental and submandibular in the front. Okay. And the supraclavicular lymph nodes. Mobile again. Alright. I'm going to check the axillary lymph node as well. Mobile and not enlarged. And the pectoral one. Good. Alright, and over on this side. Okay, axillary and pectoral. Good. So no indication of any lymph node enlargement. The dermatomes are okay. Not seeing anything abnormal from a neurological point of view. In your upper frontal torso, I'm going to go ahead and focus on your back and your scalp as well in the back.
Okay.
All right.
So cranial nerve exam indicated no positive findings. Dermatomes were normal. Skin sensations checked it out. Sharp, cold, dull sensations not interchangeable. Eyes, ear, and neck. No positive findings. Alright. So let's go ahead and look at the back now and evaluate the spine. Check sensations and see if we can find anything else that may offer us a clue on what's going on. I'm going to set this aside. I'm going to begin by doing just a scalp inspection. I'm seeing a normal hair distribution, no redness, no discharge, nothing indicative of any abnormalities of the scalp. to go ahead and test for any breakages, any abnormal detachment after hair follicle, anything that may be indicative of abnormality of the skin on your hand. Okay, no abnormal breakages noted. Right. Is it okay if I clip your hair up in a ponytail, Emma?
Yes.
Okay. Right, we're working with a lot of hair here. Okay, that's good. Just going to inspect your spine and your back first. Just looking for anything that may be abnormal, such as different colors, any bumps, any unusual swelling. I see your scapulas are symmetric. Okay, the spine is straight. Shoulders are symmetric, even elevation. Right. I'm going to check your back temperature. Okay, even temperature, no excess sweating. Can you push back into my hand? Okay, good. Alright, I'm going to go ahead and slide down this object down your back over your spine, and I'm looking for any reactions that are normal, any tenderness, any feelings of zapping. to go ahead and tap on your back and listen to the resonance of the sounds that come from my medical hammer. All right. Good, no hyperresonance, no dullness, just the expected level of resonance. Right, I'm going to go ahead and do the same sharp or dull test that we did on your face over on your back. Go ahead and tell me if you feel sharp or dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. All right, and now can you tell me when you stop feeling the dullness? Yes. 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 Okay. Okay, so the dermatomes in your back are intact. From a sensory neurological point of view, I'm not noting any concerns. There is no loss of sensation or sensitivity, no discontinuities in the nerves that innervate your back. I am going to do a treatment next, and I'm going to attempt to stimulate the nerves that innervate your back.
Good.
And this will promote healing and an increased blood flow supply into your back, that hopefully it's going to relieve you from the negative feelings you've been feeling.
Okay.
also going to do some light cupping therapy and continue to increase the blood flow in your back. Okay, Emma, so I was not able to find anything abnormal with you. I believe that the sensory issues that you're experiencing will go away in a couple of weeks.
Okay.
Just stay off of any horses.
Yes.
Good that you're wearing a helmet though, so
Yes.
I do recommend you keep doing that.
I'm glad it's nothing serious.
Yes, no concerns whatsoever. And how did the back treatment feel?
It felt really nice.
Yeah, good.
Yes.
All right.
Maybe I should come back again for another massage.
Sure. I'd be more than happy to do that for you.
Thank
so
you.
let's go ahead and check back in a couple of weeks and
Yes.
see how you're doing.
Great. Thank you so much.